All right, so I would strongly suggest that people do not do LASIK surgery. People have been driven to end their lives. They've actually ended their lives because of pain, severe dry eye, um, seeing halos, especially at night, blurred vision. Their symptoms have never gone away, and they did not want to live the rest of their life like that. There was a police officer who ended himself because of it. There was an not ophthalmologist, excuse me. She was a meteorologist, and she ended herself because she couldn't handle the pain. And you have to understand that when you're dealing with someone whose sole purpose is to make money off of you, and they don't really care, they care more about money than you, they're going to sell you the moon. They're going to sell you the moon. They originally said in the original literature when LASIK was hopping, there's only 1% that has problems. Bullshit, and triple layers of bullshit, okay? More and more people are having chronic problems. I'm going to post Dr. Oz's show where these two women have had complications ever since they had surgery. I saw another documentary where a guy had LASIK and it's 19 years post-op, 19 years, and he still has problems and he wishes he never had it done. My initial and continued commentary about LASIK is if they screw your eyes up, you got nothing to fall back on. That's always stayed in my mind. And you had the whatever Institute of Ophthalmology saying, oh, no, they're playing down these symptoms because they make a boatload of money all the time. So they're going to tell you that it's not, that there's no complications. It'll make your life perfect because they're relying on that money. They're relying on that greed. And that takes precedence over everything else. And patients have even said when they do these statistics, they're doing them based on short-term symptomology as opposed to the rest of that patient's life or even years down the line. They're not doing studies on that. They're going to brush off the symptoms and act like, well, yeah, any procedure has risk. Shut the hell up. That, no. A lot more have massive risk and problems after surgery, and they never resolve a lot more. I'm not saying there's not success stories, but here's another thing that they're never going to tell you because they're greedy for your money while they're selling you the moon, the stars, and everything else. They're not going to tell you that. And this comes from a guy that I talked to, and his mom is a doctor, and she said, you have that surgery done, and if you have any kind of head trauma, which no one can guarantee that they'll never have head trauma, you will bleed excessively. You will basically hemorrhage because of having that surgery prior. Ain't nobody gonna tell you that. Okay, we do the real over here, remember? It's gonna be sold to you like everything else that makes a lot of money. You're gonna see 2020, your life's gonna be grand, you will feel like you've had a brand new set of eyes. For some people, that may be true, but when they scrape your eye, they damage the nerves that produced moisture to your eyes. So these people have spent, people who it didn't go well for, which they said 1%, and now they're saying 30% of people don't do well. And it's probably higher than that. The people that do not do well. I mean, you're driving people to end their lives. Come on. Okay, there's a clue. But I'm glad that more and more patients are coming forward because the patients are going to tell the truth and the doctors are going to continue to lie or diminish the problem because they're making so much money that there's no reason to tell the truth. There's no incentive to tell the truth. The patients, however, are not getting rich, so they will come forward and tell the truth. And they make it sound like it's no big deal. No big deal, my ass. You're messing with someone's eyesight, for God's sakes. So basically, an ophthalmologist uses an ultraviolet laser to permanently change the shape of the cornea, which is the clear covering in front of the eye. An ophthalmologist is a type of eye care provider who has a medical degree and may perform eye surgery. LASIK is designed to correct vision problems that make it harder to see clearly. This includes people who may be nearsighted, objects appear blurry at a distance, farsighted, objects feel blurry or appear blurry up close, or have an astigmatism where objects appear blurry either at a distance or up close. The procedure has a high success rate. According to this article, about 90% of people who have LASIK surgery may end up with vision between 2020 and 2040, and they may also be able to stop wearing eyeglasses or contacts for good. However, that is not exactly totally true either. There are patients who had to wear glasses all over again because their eyes need additional support, even though they had the surgery. They're not going to tell you that part. LASIK may not be for everyone. It comes with risk of certain side effects and complications. Here are some of the things to be aware of. They're going to use two different type of lasers. Um, the first laser creates a flap in the cornea, and the surgeon lifts it manually. And the second laser is used to sculpt the cornea in a different shape. The surgeon will then put the flap back, give the patient some eye drops, and they're good to go, according to this. During LASIK surgery, your eyes are numb. That way, the person may not feel pain, though they may feel a little discomfort from the speculum, the object that holds their eyes open. During the surgery, the procedure takes less than 30 minutes, with 10 to 15 minutes spent on each eye. The doctor will send the patient home with eye drops that may prevent inflammation and infection. Patients may put them in for anywhere from 2 to 4 weeks. Um, Dr. Chen says another thing they may experience, patients may be sensitive to light and have some pain the night after the procedure, but the next morning they should be all right to drive or walk over for their follow-up visit with the surgeon without wearing their glasses. The first day, an eye care provider will have people wear protective clear patches or special glasses so they don't rub or accidentally scratch their eyes. There may be dryness, fogginess, or the feeling like something is in the eye, but this will clear up each day during the first month, and that's a lie. Some patients do not ever recover from those symptoms. Okay, she's lying. If the eyes don't feel normal after the surgery, it's a good idea to schedule a follow-up appointment with an eye care provider. More and more people are coming forward with the long-term permanent symptoms after this procedure. It's possible for some people to experience side effects after the procedure. These issues usually subside over time. That's not always true. And there's a chance they may not go away. There's a bigger chance they're not going to go away. Here are some possible temporary or even permanent risks of LASIK: blurry, hazy, foggy, or double vision, seeing halos, starburst, glare, or ghost images, light sensitivity, trouble with night vision and or driving at night, infection of the cornea, small pink or red patches of blood on the white of the eye, which is called the sclera, scarring of the cornea or permanent problems with the cornea shape. Serious complications are rare. That's not true. According to the American Academy of Ophthalmology, which makes a ton of money off of you getting it, so they're going to minimize the complications. With the new lasers, side effects are minimal. That is not true. For some people, it may take up to 3 to 6 months before their vision stabilizes and for them to see clearly. Also, LASIK can't correct or prevent presbyopia, the age-related loss of being able to focus on near objects. People may still need their reading glasses or expect to need them once they become middle-aged. There are some medical conditions or circumstances where a person may be more likely to develop complications. These include glaucoma, the corneas may be too thin, inflammation or infections of the eye, cataracts, dry eyes. Um, the dry eyes can be a permanent, and is for some people a permanent issue. One guy had corneas that were too thin. He found that out from another doctor because he was having so many complications. and his corneas were too thin for LASIK, but the doctor said he was a perfect candidate for it, which they found out later. The guy found out later that was a lie. Like I said, when there's a lot of money to be had, everybody qualifies. Disgusting behavior. Certain medical conditions, autoimmune diseases like rheumatoid arthritis and lupus, and autoimmune disease may make a person more prone to infection or make it harder for them to heal. Diabetes, which may put a person at risk of diabetic retinopathy. This is a serious eye condition as a result of diabetes. If a person's eye prescription changed much in the last year, teenagers or young adults who still frequently need a new or stronger prescription, I'm sorry, women who are pregnant or breastfeeding, hormones may change vision temporarily. It's the diminishing of the symptoms is what's pissing me off. Okay. Oh, there's only a small percentage of people that have those issues. Bullshit. Stop lying for money. Fucking liars. Um, when somebody takes their life, and we don't even know the percentage of people who have done that, I'm just now hearing about. Now, one of them I did know. She was like I said, the meteorologist. She had chronic pain that never went away, and she was done with it, and she just signed off. But also, when you look at the NFL, we're going to go there. Um, the NFL also said that there was no such, like CTE, which is chronic traumatic encephalopathy, or I think it's encephalopathy. Um, I'll look that up in a minute, double check. But oh, that doesn't happen in football, and this and that. It happens all the time in football. But look how much money the NFL makes. So we're going to use our money to downplay CTE. And football players are notorious for having that as a result of having multiple concussions. And when the movie came out, the movie based on the true story, and the doctors specifically examined these brains of people, they can't diagnose you when you're alive, unfortunately. And he brought this information to the NFL, and they basically denied it and said he was full of it. No, you're full of it because you're greedy for money, and that takes priority over everything else. Oh my. Uh, let's see here. Literature reviews suggest that intraoperative complications include suction loss, free cap, flap tear, buttonhole flap, decentered ablation, central island interface debris, femtosecond laser-related complications, and others. Um, the postoperative complications include flap striae, flap dislocation, residual refractive error, diffuse lamellar keratitis, microbial keratitis, epithelial ingrowth, refractive regression, corneal ectasia, and others. They're fancy words for complications after the surgery. Mm-mm-mm. Still remains the most commonly performed refractive surgery world over. Well, of course, because it makes a lot of money. So they're going to tell you, they're going to lie to you about the percentages. That's why you have to do your own research. Don't listen to them. Because, like I said, your money, your wallet is more important than your safety. Oh, damn. Bear with me a minute. I have an issue with my thigh, and we'll talk about that in a minute. And I'll talk to you about why I have an issue with my thigh. Complications. Compli. I can't spell. Complications. After Lasik. I don't understand why that won't. Okay. Most serious LASIK complications, corneal ectasia, which is a rare but devastating complication where the cornea weakens and changes shape, often months or years post-surgery, leading to blurry vision that cannot be corrected by glasses. Chronic severe dry eye syndrome, persistent painful dryness caused by nerve damage during flap creation, which may result in severe stinging and sensitivity to light. Corneal neuralgia, neuropathic pain. A subset of patients develop persistent disabling pain, burning, and light sensitivity, even when the eye appears physically healed, which is resistant to traditional therapies. Severe visual disturbances, permanent and debilitating diplopia, which is double vision, glare, halos, starburst, or loss of contrast sensitivity, infectious keratitis or endophthalmitis, rare but aggressive infections that, if not treated immediately, can result in severe vision loss. Flap complications, issues such as flap folds, which is striae, or dislocation, often resulting in significant vision impairment. Common post-op side effects, usually temporary but not always. Dry eyes affecting 20 to 40% temporarily, 1 to 2% permanently. I don't believe in the 1 to 2%. That's what they've been saying, and people are coming forward saying, no, I'm a result of symptomology that's been going on for many, many, many years, and I regret doing it, okay? Not me, but patients that have said that. Light sensitivity, which is photophobia, small red patches on the white of the eye. Some patients report persistent pain and vision impairment so severe it causes intense distress. Online support groups, such as those mentioned by survivors in The Guardian and the New York Times, have thousands of members discussing their long-term complications, such as chronic inflammation or the need for specialized contact lenses, which are scleral lenses, to improve vision. The FDA considers, of course they do, LASIK safe and effective, but notes that patients should be aware of the potential for rare but serious complications. These complications are not rare. I'm pretty sure that if we were to dig into the real statistics and talk to real patients who have these issues, not what was bullshitted on a piece of paper and then spread like wildfire. Oh, it's 1%, 1% my ass. Okay? Give me a damn break. Surgeons review, they consider LASIK, you know, just no big deal. Like, it's routine for them. Well, right, it's not, no big deal because they're not the one going through the hell for the people who do go through this, okay? Robin Kyle Reeves lived an active life in Laurel Hill, Florida. She made lace gowns for children to wear during baptisms or family portraits. It was intricate work that requires precision, and her glasses kept getting in the way, so her doctor recommended LASIK. The procedure, which uses lasers to cut in and reshape a patient's eye, was billed as simple and quick, usually done in under 30 minutes. It was supposed to be zip zap, and within a couple of weeks, you're healed and life goes on. That should tell you, that should be a red flag too. Anybody who tells you, any so-called doctor who tells you, oh, you're going to be better than new, you could do cartwheels right outside, as soon as you get the procedure done, you could do cartwheels, you'll be perfectly fine. Bullshit. They don't know what the long term is and how your body's going to respond to that. But again, they have their eyes on your wallet, so there's hardly almost no complications ever. Uh-huh. Sure. Anyway, my life has stood still since July 12th of last year, and this article was written 2023. According to Reeves, the procedure left debris behind her corneal flap, which ruined her eyesight and causes double vision, intense migraines, and eye strain. She finds it impossible to stare at screens for an extended period of time and can no longer enjoy her hobbies. She quit her job and had to repay deposits when she realized she could no longer focus on sewing. It puts a big dent on our household income, Reeves said. My head hurts all the time and I can't do normal activities. Simple things like reading a box of mac and cheese or putting on the same makeup I've applied for 40 years. I just can't do it. Reeves is one of the 500,000 Americans who undergo LASIK every year to correct their vision. About 100,000 people in the UK have the surgery annually. Surgeons who perform LASIK view it as routine. That should be a red flag too. Nothing on your eye should be routine. Slicing into your eye? Come on. Touting surveys promising a customer satisfaction rate of 90 to 95%. Uh-huh. Surgeons who perform LASIK must have the standard board certification in ophthalmology, and it is recommended that a patient choose one with a 1-year accredited fellowship in refractive and cornea surgery. That extra step is not necessary to perform LASIK, but specialists who have it are more likely to get referrals from other generalists. The American Refractive Surgery Council says the procedure's complication rate is less than 1%. They've been saying that, but the percentages are actually higher, and patients will tell you that. Although 30% of people may see short-term side effects like dry eyes. The patients that I saw in the documentaries that I saw, they still, I think it's a guy, 19 years post-op, still having problems. So I'm not really trying to hear your fake percentages. Um, Doctors also say that using new lasers significantly decreases complications compared with the older generation models, which were used in the early 2000s. No, no. Anybody who's slicing into your eyes, I don't give a damn if they use a new laser, an old laser, an extra new one. It doesn't matter. They're still cutting into your eye. Okay? There's nothing that's going to be more gentle or less damaging. It's still a goddamn laser cutting into your eye. I'm not telling people not to do it. I'm just telling you be aware what you're signing up for and be aware that you could be one of those people who has terrible complications for the rest of your life. Your eyes are too sensitive to play with. Patient advocates and some experts say that is not the full picture. Dr. Morris Waxler, a retired FDA advisor who voted to approve LASIK in the 1990s, is now one of its biggest critics. He says he regrets his role in bringing the procedure to the public. According to his own analysis of industry data, the complication rate of LASIK falls between 10% and 30%. Exactly, those are real numbers. One investigation of an FDA database by the reporter Jace Larson found more than 700 complaints of severe pain described as worse than childbirth or as if their eyeballs would stick to their eyelids almost every night. Yeah, 10 to 30%, if not higher. Those are real numbers. Last year, the FDA released draft guidance telling doctors that prospective patients should be warned they may be left with double vision, dry eyes, difficulty driving at night, and persistent eye pain. In one clinical trial from 2017, the FDA found that nearly half of participants reported experiencing new visual symptoms after undergoing surgery. Those effects can show up as the uh, presence of glare, halos, or starburst, especially at night. Stop that. Page is doing something weird. The guidance is not final. A spokesperson for the FDA told The Guardian that the agency was currently in the process of considering hundreds of public comments submitted on the draft guidance. These comments include strongly worded rebuttals from ophthalmologists who say the procedure changes lives for the better and regretful patients who wish they had never gone without it. Ophthalmologists are going to say whatever the hell they need to say to get that money going. You understand that, right? They're going to say they're going to diminish patients with issues. It's only 1%. We know that's not true. Okay. But when your fancy house and your beachfront property and your expensive bills and your boat and everything else have to be paid for, your sports cars have to be paid for. No, there's almost no complications. Disgusting. Um there's one lady who Paula Kofer, she's from Tampa, Florida. She testified in front of the FDA in 2008 and 2018, said her experience has started with visual symptoms. Kofer paid about 1,000 in 2000 for the procedure. So back in 2000 she paid $1,000, which she knew next to nothing about it at the time other than it was her ticket to a life in which she no longer needed glasses. But she started to notice complications almost immediately. The first night she went out and looked at the moon, Kofer saw 8 overlapping circles smeared with a ghastly halo around it. It looked like something out of a horror movie, she said. Now she lives with severe dry eye and bad night vision. She owns 4 pair of glasses to make up for the eyesight she's lost. Kofer is one of the loudest critics of LASIK. She runs a Facebook support group with over 8,000 members who swap stories of their post-op ailments. There is an epidemic of LASIK complications. A number of people on the group claim LASIK has led to them having severe mental health crisis or severe mental health issues. Oh my God. Oh my God. 2019, a Florida car dealership comptroller named Gloria McConnell asked her eye doctor for a new glasses prescription, according to her son Kingsley Alec McConnell. She had recently undergone LASIK surgery, which had fixed her problems seeing from a distance, but she still dealt with farsightedness, and although a pair of readers and thought a pair of readers might help, during the appointment, McConnell's doctor talked her out of the idea, and she decided to try one more attempt at LASIK to fix the problem. Jesus. 4 years later, after experiencing debilitating complications from the procedure that left her unable to leave bed most days, McConnell died by suicide at the age of 60. Her son said that in the note she left to her family, McConnell wrote that the pain of the botched LASIK surgery had contributed her decision to end her life. Kingsley described his mother as fun and youthful before she had the surgeries. The complications crept into McConnell's life a few weeks after her surgery, but she tried to stay positive. Still, as things continued to grow worse, she became a shut-in. Her main issue was chronic dry eyes, to the point that she told people it felt like her lids were burning. She also suffered from corneal neuralgia, which is caused by damage to the nerves of the cornea. She had mites and ingrown hairs in her eyelashes and inflammation of her eyelids, and spent most of her day lying in bed with her eyes closed. The pain affected her whole head. Her son said she did not take her life randomly or in the heat of the moment. In a way, it was a rational choice for her. Why would you live a life so full of suffering? McConnell submitted a comment on the FDA's draft guidance in November. LASIK has destroyed my life, she wrote. My doctor told me, again, money. My doctor told me I was the perfect candidate for LASIK and never talked at all about the risk. Please help people like me. Mm. After 30 years, the FDA has finally decided that maybe they should require refractive surgeons and manufacturers to tell their customers a little more about the downside of LASIK. If surgeons told people of all of the possibilities of getting complications, they wouldn't have any customers. Right, and they wouldn't be getting paid fat dollars. So they're going to diminish the symptoms, and they're going to lie and say only 1% and this and that. Uh-huh. If you slice, McKay is Dr. Cynthia McKay, a retired clinical professor of ophthalmology in Columbia University Medical School. She was the first ophthalmologist to recognize the significance of the laser used in corneal refractive surgery. I thought it would never catch on. If you slice into the cornea to change its shape, you're going to cut through all of the nerves that feed the cornea and keep it healthy, which will result in terrible pain. Okay? Oh my God. She said, I think LASIK should be banned. It's a public health hazard. There's an epidemic of pain and blindness all over the world because of this procedure. Very long article. I'm not going to, well, I mean, it's almost done, but this is on theguardian.com. And the title is The Patients Who Regret Laser Eye Surgery. My life stood still since then. And I'll put the title and all that in the description of this podcast. All right? You guys take care. Like I said, we keep it real over here. We're not gonna play games, especially with somebody's vision. That's absurd. Y'all take care. Much love. Bye-bye.